I'm here. This is Dr. Subramanian, Tyagarajan Subramanian. And if everybody could mute on their side, we have muted everybody here as well. We will open up for questions after the first initial presentation. Samyu, can you hear me?
Yes.
Okay, good. Excellent. So earlier today, I listened to a presentation by the Michael J. Fox Foundation, and I'm going to share the Michael J. Fox Foundation slides here with all of you so that we can use this as a talking point. It was a presentation in which a number of other people participated, but here I'm just going to use this as a talking point to help us get through all of what we have to say today. I thought it was important to have this session because we have been receiving some phone calls at the APDA, American Parkinson's Disease Association phone lines, and these questions have been sort of common to all the things that we want to, okay, let me see if the screen can again show. So apparently the screen is gone. Let me see if I can bring it back up. Let's see here. Okay, is it sharing now, Samyu?
Yes.
Okay. All right. So okay, let me go to the first slide here. Okay, so yeah, so the questions have been mostly about the coronavirus and how it might affect people. So let me give you just a quick 1 minute overview. Most of you already know all of what I'm going to say about the coronavirus, but I think it's probably worth repeating very briefly what we already know about coronavirus. So corona is a very small virus, and it's in the same family as many of the flu viruses and cold viruses. So it produces primarily symptoms that are very, very similar to the flu. Later on, I will show you very specifics on what the flu-like symptoms are and how they manifest in the case of corona. But needless to say, there's not a whole lot of difference between the flu and the corona infection, and that's the problem. The common symptoms are fever, cough, and shortness of breath. Older people with serious medical conditions, heart disease, diabetes, lung disease, could be at a higher risk and more serious risk. And a lot of still is not known about the corona spreads, but it may be possible to spread the disease even before symptoms arise. That last point is probably the most important thing that we all need to keep in mind, is that corona can be silent in people and it may not manifest until much later. And one of the key questions that everybody asks is, having Parkinson's put you at a higher risk for corona or not? To the best of our knowledge, that is not the case. Just simply by having Parkinson's disease, you will not be at a higher risk for developing corona infection. So COVID-19 does not put you at higher risk just because you have Parkinson's disease. So let's just keep that answer very clear and on the top of our agenda. However, as most of you already know, Parkinson's is a age-related disorder. So the people at the highest risk for the disease are people over the age of 60. And since Parkinson's disease affects people typically 65 and above, a good number of Parkinson's patients are in that category, although there is a small minority of young onset Parkinson's patients who have disease onset a little bit earlier, between the age of 40 and 60, and some even younger. But vast majority of Parkinson patients are in the 60 plus range. So disease of concern to many of you because you're worried, how does this affect me? So using this talking point, we'll go to the next big talking point, which is some patients with Parkinson's may be in groups with increased vulnerability and have more serious illness. So what does that mean? That means that if you not only have Parkinson's, but you have other disease, for example, some respiratory illness already, example would be COPD, chronic obstructive pulmonary disease, or asthma, then you are a bit more vulnerable. And if you have diabetes or metabolic diseases and it's not very well controlled, then you may be at a little higher risk. Or if you're immunosuppressed for some reason, if you have either kidney transplant, liver transplant, or you have serious arthritis for which you have been put on immunosuppressive drugs, then you're at a higher risk for corona infections. So although Parkinson's itself does not give you any higher vulnerability for this particular disease, it does put you at higher risk if you are in any of these high-risk groups. The second part, which is probably what everybody already knows, but it's worth talking about, is that if you do get an infection, and as with any other infection, Parkinson's symptoms can become worse if you get an infection. As most of you already know, most of our listeners already know, most of the people who suffer from Parkinson's already know, urinary tract infection and upper respiratory infection frequently makes their Parkinson's symptoms worse. So again, if you have the flu, you could be more symptomatic. And if you have the coronavirus, even if it is a milder version of coronavirus, you could still have more Parkinson's symptoms. You could become more tremulous, have more tremor, or you could have what we typically call the off time, where your medicine seems to be not as working well. That could happen. And of course, as we just briefly mentioned, if you have a high fever, if you are short of breath, and you're coughing and sneezing all the time, your anxiety levels are going to go up. And because your anxiety level goes up, that can also worsen your symptoms. Your tremor can become worse, so on and so forth. Just thinking about all this, putting our life on a hold and changing the way we do things is itself stressful. So many of you may be experiencing anxiety-driven worsening of symptoms. That could also be a problem. And then finally, some cold and cough medications may interact with Parkinson's disease. So it may be important to talk to your doctor or talk to the pharmacist before taking them. So the medication that is most often implicated for this, and those of you who have a piece of paper and pen, if you want to write this down, you can. I will say this very slowly. It's called dextromethorphan, D-E-X-T-R-O-M-E-T-H-O, fan, V-H-A-N, dextromethorphan. Again, I'll say that one more time, D-E-X-T-R-O, dextromethorphan, M-E-T-H-O-R-P-H-A-N. And I'll make sure that Samyukta puts this in the chat box, the name of this particular compound, so you guys can look at the chat as well. Those of you who are watching this on the video can see that on the chat box, that dextromethorphan is the drug that is commonly present in many of the cold medicines. Mucinex is one example, Robitussin, NyQuil DM. These are common medicines in which dextromethorphan is present. In theory, if you take a lot of the dextromethorphan, a high dose of dextromethorphan, and you are on one of the monoamino oxidase inhibitors, salicyline, rasagiline, or Xadago, those three medicines, some of you may be taking that. There is a theoretical risk that they can interact and cause hypertension. So the important thing that I want to communicate with all of you is that If you have a cold and you need to take cold-like symptoms and you have to take cold medicine, it's okay to take cold medicines, and you just need to monitor your heart rate and blood pressure. This can be easily done. Most of you have blood pressure machines at home. If you don't have one, you could ask somebody to get one from the pharmacy, a cheap one, and just get your blood pressure measured before you take the cold medicine and after you've taken the cold medicine. It's a theoretical risk. In my experience of many years, this hardly ever happens. So this is not a big concern to take cold medicines. So if you have to take symptomatic cold medicines, it's perfectly safe. If you avoid dextromethorphan and take medicines that don't have dextromethorphan, and typically there is a D in the drug, so NyQuil DM, Robitussin DM. So dextromethorphan, when it's added, has the D at the end. Mucinex DM, it has that D written. D stands for the dextromethorphan. And if you don't take the one with the dextromethorphan, then you should be okay in most cases. But if you have only that one at home and you want to take it, and that's the one that works well for you for your cold symptoms, it's okay to take it. But you just need to monitor your blood pressure just to make sure that it doesn't shoot too high. That's the talking point here. Now, this is probably the most impactful slide here. And this is why the government here and the local authorities have tried to put social distancing and physical distancing for all of us. So as you know, in all of this area in central Pennsylvania and almost all of America, we've been asked to stay at home as much as possible and limit our times that we go outside and interact, except for maybe if you have to go for work and work, it requires you to go to work. Otherwise, telecommute, you do the work from home using the phone or the computer, and limit the time that you go out for grocery shopping, and maybe absolutely essential doctor visits, go for absolutely essential doctor visits only. So what is the rationale for doing this? Why are we doing this? The main reason is that we know COVID will infect approximately 50 to 60% of the population. We know that from what has happened in China, what has happened in Japan and South Korea and Italy. We know that the disease is here and it's going to affect 60 to 70% of the population is going to get infected. And of that 60 to 70% population, a very small percentage is going to have very serious infection that will require you to actually get hospitalized and taken care of in a hospital. Now, those small percentage, even though it sounds very small, when you look at a population, that's large numbers. So for example, right now in Pennsylvania, the latest numbers are, we have about 150 patients who are affected. In our own area, Cumberland County, as of this morning, has 10 COVID positive cases. And if you look at the death rate, the number of people who have passed in Pennsylvania, it's very small. It's only about 3. And the reason for that is that for the infection to run its course, it takes about 3 weeks. So what we have to look at is what was the infection rate 3 weeks ago? And 3 weeks ago, the infection rate was very small. We had less than 20 cases in central Pennsylvania. I mean, all of Pennsylvania, not central Pennsylvania, all of Pennsylvania. And we had no cases in central Pennsylvania. Cumberland County had 0, and Dauphin County 0, York County 0. All these counties were 0. Now we have cases popping up. So the serious infections are going to come 3 weeks from today. And what we don't want to do is what's shown in this slide here, that we get a huge peak, that suddenly a lot of sick people occur, so much so that we overwhelm the hospitals, and the hospitals and the doctors are not able to take care of people, so much so that there are not enough ventilators, there are not enough nurses, there's not enough medication, there's not enough masks, there's not enough gloves to take care of that many sick people. So what we want to do is to try to flatten the curve, which means, yes, we're going to get infection, but we're going to put it off slowly. So it's going to happen over a longer period of time. So this in medical terms, in epidemiological terms, is to flatten the curve. So what we're trying to encourage people is to stay at home so that the risk of many people getting the disease at the same time is reduced, limited, and therefore then we won't overwhelm the healthcare system and make it so difficult for people not to be able to be taken care of and become so sick that our healthcare systems are overwhelmed. So that's what we're trying to do. Now, this has practical consequences for many of us. So let's talk about some of the practical consequences for many of us. How do we adapt to these changes? How do we take care of ourselves? And how do we make sure during these difficult times, how do we take care of ourselves? So first things first, you all need to take your medicines. So you need to make sure that you're stocked up on your medicines and don't wait until the very last minute to get refills. So if you're running short, please call my office or your other doctor's office and ask them for doing a refill on a timely fashion. You know, the supply chain is challenged. There are many people who are working very hard to make sure that the supply chain is kept up to speed. Most of the pharmaceutical companies are doing their best to make sure that the pharmacies are stocked and medications are available for everybody. But it's also prudent for us as patients and consumers and doctors to make sure that your prescriptions are filled and appropriately run in a timely fashion. Please call your doctors and nurses to make sure that these numbers are correct. Now, if you have enough, then there's no reason to call. You don't need to go hoard up on medicines, just like some people have been hoarding up on a few of the essential items like water and toilet paper, which is completely unnecessary. And we'll get to that in a minute, but you don't need to hoard your medicine. But it's important that you have sufficient medicine to take. You don't want to run out of medications. You don't want to run out of medication anytime, but you don't want to run out of medicine in this situation. Now, is it okay for you to go to the pharmacy to pick up medicine? Yes, it's okay. Now, of course, if you're sick, you should not go. You should ask somebody else to pick the medicine for you or ask for a delivery to bring the medicine to you and drop it off in your front door. Most of us have now mail order medicine, and I would encourage strongly that you use your mail order to get your medicine. Even though you may have gotten your medicine from your local pharmacy, in this difficult situation, you either ask your local pharmacy for a delivery, which many pharmacies are doing these days, or you ask for a pickup at the door. You can call them and say, I'm coming, can I pick up at the door, instead of going and walking around to the pharmacy and standing in a line, which we can try to avoid if at all possible. Now, of course, if you can't do any of those things, you can ask somebody to pick up the medicine and drop it off for you, and that would be perfectly okay too. So having all your Parkinson medicines with you is important. So that will keep you healthy, keep you functional. The second thing is that what if you had an illness? If you had a cold, flu-like symptoms, then what do you do about it? You do common sense things. First of all, take your temperature. If you have a thermometer at home, take your temperature. If you have to take cold relieving medications, as we already discussed, take them, and preferably take Tylenol. Do not take ibuprofen. There is some debate of whether it's okay to take ibuprofen or not. It's not clear whether it's okay to take add-on ibuprofen. Now, if you're already taking ibuprofen for something else, you have arthritis and you're taking, for back pain, you're taking ibuprofen, do not stop it. Continue taking it. We're talking about taking more ibuprofen for a cold. That's what we're talking about. So in that situation, if you have cold, you have aches and pains, and you have to take medicine for aches and pains, prefer to take Tylenol or acetaminophen. That's the better preferred drug, and try not taking the non-steroidal medication. On the other hand, if you're already on a non-steroidal medication, you're taking ibuprofen or naproxen or Motrin, you're taking that for some other condition, keep taking it, don't change it. If you have any doubt, call your primary care doctor, talk to them, tell you're having cold-like symptoms. Now, if your symptoms are not relieved, your fever is going up, you're having lots of cough and a lot of sore throat, lots of aches and pains, then please call your doctor's office and they will be able to advise you as to where you should seek care. In Hershey here, Hershey Medical Center, we do have an online portal and a phone portal that you can call in. It's called Penn State Health App, APP. It's an app that you can download on the phone, and you can use that to call a provider 24/7, and you can use that. And again, I'm going to ask Samyukta to put that on the chat, so those of you who have access to the chat can see the chat. It's the Penn State Health App that you can download, and you can use that to inform your doctor or any doctor that, hey, I'm sick, what should I do next? This facility may be available in other healthcare providers in this area. You can contact your healthcare provider, whether it's the UPMC or whether it's York Hospital or Lebanon County Hospital, whatever. You can contact them and say, hey, if I have illness, who should I call? And typically, the local authorities have made arrangements for you to be cared for remotely at your house. They can give you advice on what to do, et cetera, et cetera. And if you need testing, again, we have drive-through testing available in Hershey. So you can come in your car without going into the hospital, without going into the emergency room. You can come in a car and they can do a throat swab on you and do the test without you potentially contaminating the hospital or any other facility for having a test done. That's available here in Hershey, but it's only available if you already called on the app and the doctor told you, made an appointment and said, hey, come to the drive-through at a certain time. It's not available otherwise. It's not open to public. You can't just walk in there and get the test. And the reason why that's the case is that there's only a limited number of tests available. And of course, the country is scrambling to get more tests, but right now, the limited amount of tests is meant for making sure that people who really need the test are getting the test done. So anyway, that's what you should do if it is getting to a point where your fever is not going away, you're coughing, and illness is progressing. Now, in this illness, corona, unlike the flu, it becomes really bad after the 7th or 8th day. So the symptoms that first start out is a few sore throat and fever, typically. At least in the Chinese experience, that's what they saw. Most of those patients had a pretty bad sore throat and a pretty decent fever. The fever progressed on over 5-6 days and continued to go worse. There was some coughing. Some people, more serious cases, had diarrhea. It was only a minority of them that had diarrhea. Aches and pain all over the body. These are typical symptoms that we see in any flu, any cold-like symptoms. You have all these symptoms. But then after the 7th or 8th day, symptoms really got progressively worse. Shortness of breath, difficulty breathing became more and more worse. And then they had to be taken to the hospital and cared for in the hospital when it got really bad. Again, it only happened in a small minority of patients. And those small minority of patients had the case fatalities or people who passed away. Now, this is a very difficult area to talk about because we don't have enough data. We simply don't have enough data to make predictions on how things are going to happen in the United States. All we have is data based on what happened in China and Italy and Singapore and other countries wherever the illness happened. That's all the data we have. And earlier this morning, I was in another conference call with the Michael J. Fox Foundation, and we had the epidemiologist from Vanderbilt involved in that. And he's in very close communication with the epidemiologist in London at the Imperial College, Dr. Ferguson, Neil Ferguson, who's a world authority on viral infections. And our own experts here in central Pennsylvania, in Hershey and others, have also commented on this. This is a moving area. We don't have the data yet. And I am no epidemiologist. I'm not here to give you epidemiological advice. I'm only talking to you as your Parkinson doctor and the APDA INR director. So I don't want to pretend to be an epidemiologist, I'm not. But what the consensus of the population of people, the experts in the area, is that this is a moving target. We don't know what the case fatality is going to be in USA. We don't know. But based on whatever happened in other countries, this is a serious illness, and up to 1% mortality has been predicted. And even 1% is a very high number. Okay, now, next point here in the slides, for those of you who can see the slides, is that you should talk to your insurer and your local pharmacy about medication coverage and at-home medication delivery options. Again, don't overwhelm the system. If everybody calls at the same time, it doesn't work. So try and choose and pick and choose who you call and do it in a sequential manner, so that right after this call, everybody's not calling everybody. Take your time. It's not like that urgent. And then as far as going to your doctor's appointment, which is another important thing to talk about. If any of you have a scheduled doctor's appointment with me or any of your other Parkinson's doctors, you need to think about it and say, is it worth for me to go there or not? If you're doing really well and you've had a good run and nothing serious is going on, you don't have a lot of tremor, you don't have a lot of symptoms, you don't have dyskinesia, you have relatively minor problems, and you don't really need to go make the visit, we do have the option of using telemedicine now. The federal government has made it available that telemedicine can be used, so we can do a phone consultation and we can solve most things over the phone and don't have to physically come in to see the doctor in most cases. Now, of course, if you're doing poorly, if you're falling, you're having lots of dyskinesia, you're hallucinating, your medication is not working well, etc., of course you need to be seen and your doctor can make a determination that you should come and see. But if it's not, you could choose to have a telemedicine visit, at least in the short run. And this can be as fulfilling as a full visit, because now we have permission to use the telephone. And in some cases, if you have the correct software, we can also do telemedicine using video conferencing. So we should be able to see you as well. Now, of course, that's limited and the details are being worked out, at least in Hershey. But we definitely have the ability to talk to you on the phone and do a full-fledged phone consultation where we can discuss all your symptoms and handle it that way. And we can make adjustments to your medicine. Now, the last couple of points, which is in this slide, is how about exercise class? I used to go for my exercise every day. Now I can't do it because they told me not to go outside, etc. Well, you can still do your exercise and you indeed can go outside, but what you cannot do is congregate. Well, you need to keep physical distance. So the COVID virus is secreted or dispensed in the air. It gets, whenever you speak, cough, laugh, it comes out through the spit and the breath, and it's in droplets. And these droplets typically can be in the air up to 6 feet. And that's why they say physical distance of 6 feet is required. So what we recommend is that you can do, of course, you can go into your backyard and do exercise. You can go to your front yard and do exercise. But what you don't want to do is to get very close to people. You want to keep that 6 feet distance from people. Now, of course, this excludes family members, because your spouse, you're in the same room, you're spending time with them, you can't keep 6 feet distance from them. Or adult children and young children who are living with you, you can't keep 6 feet distance from them. They're all part of that single environment, so that's fine. Now, this becomes a little harder if you are dependent on other people for your things. You know, if you are 24/7, 365 care, or you have visiting nurses coming, or you have adult family members coming in and taking care of you every so often, then that becomes a bit harder, because now how do you keep that social distance? You know, how do you keep that physical distance, right? The trick is, one of the tricks that you can use is that if you are agreeing to be socially isolated, in other words, you stay in your house, You're going to keep the physical distance from other strangers, outside people, even your neighbor. You're going to keep that distance apart. You don't shake hands, you don't hug, you keep that distance. You can still talk to them, but talk to them at a distance, right? And if your family member or caregiver, if you have visiting nurses coming to your house, or you have nurses aide coming to your house or something like that, and they're helping you with your activities of daily living, if they also follow the same rule, they are also physically limiting their contacts, they're just coming to your house and nowhere else they're going, then you can make a partnership like that. And in that case, it should be all right. It should not be, the point is that both of you are trying to avoid contacts with other people. It's just one-on-one. Now, sometimes that's not practical, because the person who's coming to your house is going to a couple of other houses to help other people. Then it becomes a problem, right? And if that's the case, then you can be creative about this. You can create a situation where the helper has a pair of clothes that they leave in your house that they can change into. When they come into the house, they remove their street clothes, wash their hands thoroughly, nicely, completely, and give it a full minute of nice washing. And they wear protective clothing and wear a dress that they wear only in your house or wherever they're providing care for you. And then when they leave those clothes in a bag and tie it up and leave it in your house, only to be used the next time they come in. And then they go back and put their street clothes on, wash everything, clean everything, and then leave. Now, I know it's very inconvenient to do all this, but this is what is recommended by the experts, is that if you're really going to do this, that you need the care and you cannot avoid the care, you need helpers to come to your house and help you, then you want to make sure that they are not potentially contaminating you, and they're also not taking things from your house to another house and potentially contaminating other people. So that barrier, if you really need that physical help to do, would be necessary. Now, along those same lines, if you have grandchildren, you have young children, and they are living in a different house or whatever, when do I get a chance to visit with them? Because if I'm on 14-day quarantine, how do I visit them next time? So again, we have to wait for the local authorities to say when it's okay for everything to go back to normal. But right now, your communication has to be via phone or FaceTime or Skype or one of those things. You do not want to be interacting with people from a different household, people who are coming from a different environment in where you are. I know this is not the answer most of you want to hear, but this is what is recommended, and I'm just repeating what the experts are telling as the recommendation. And then as far as reaching friends and family and socializing, going to a restaurant, eating out, going for gym class, going for other activities, museum, zoo, et cetera, of course not. We're not doing any of those things. We are socially isolating ourselves. We're trying to flatten that curve. So until we are ready to get out of it. Okay, a couple of more points, and then I'll open it for some more questions. How about some of you who are in research studies? How does this impact research studies that you may already be participating? The CDC, Center for Disease Control, the FDA, Food and Drug Administration, and the local authorities, local IRBs have all advised us that any study that we can postpone, we should postpone. So we have postponed most studies that does not involve drugs or devices. So if you have a drug on board or a device on board, then those studies are continuing, again, the limited interaction. If you are over the age of 60, then we're trying to limit your visits. We're trying to make it the minimum number of visits so that you don't have to come to the hospital and be exposed or potentially exposed to any pathogens at that time. So that's all I'll say about it. I'm happy to answer questions and get people involved. So I'm going to turn off my sharing slides. And then at this point, I'm going to ask Samyukta to unmute everybody. And what I like to do is to each of you to come one at a time and ask questions. And it's often possible that one person's question is applicable to everybody. So I'm opening it up for questions.
So right now everyone is on mute, but if you want to unmute, you can go in and unmute on your Zoom. I'm just gonna let you guys go ahead. And those on the phone, I think you guys are okay.
Hi, is there a question there? Yes, go ahead, whoever is, has a question. No one has questions?
Right. We're unmuted.
Yeah.
I don't think we have any questions, Dr. Sue.
Okay.
Yeah, right. I would too, so, but then they say no walking, so I don't know. What are they gonna have cops on me? Well, I'll try to walk it tomorrow.
Okay, I will. No one has any questions. Then I can go over a few more things that I wanted to go over. But if people have questions, I will pause here for questions. So Gail, have a question? Okay, so no one has a question. Then let me also share with you a few other things. Let's see here, 1 second.
Just exit.
1 second, I will get the things that I wanted to share with you all. Okay, yeah, so let me get this on board and show you. For some reason, it's not letting me share this. Let me see. It should be allowing me, but give me one more time. Let me give it a shot. Okay, I think it'll work now. Okay, you can see what I've shared here. Samyu, can you see it? Yes.
Yep.
Okay. So this is a sort of a one-page summary of what COVID looks like from the intensivist standpoint of view, meaning with people who care for patients in the ICU, what are they thinking, and what are they thinking about this virus and what it is, what is about? So this comes from Seattle, from one of the places where a lot of COVID patients have been hospitalized and they're being cared for. So this is sort of a real quick summary of what's going on. And this might be helpful for people to hear and keep in mind. So as we briefly discussed, this is a small virus. The virus is only 30 kilobytes in size, and it's thought to have originated from zoonotic, so from some animal, possibly bat, possibly pangolins. And it can be spread by asymptomatic carriers, as we already talked about. And droplet infection via spit and breath is most likely. And then, its attack rate is about 30 to 40%. And case fatality rate worldwide is 3 to 4, although the latest estimate is about 1%. Incubation period is 3 to 14 days, up to 15 days. And the time course, most of you already know this. China notified WHO in end of December, and the national emergency was just done on March 12th. The symptoms, the commonest symptoms are 60 to 80% cough, 45% fever, 85% during the acute illness. Shortness of breath in 20 to 40%, 15% upper respiratory infection, and 10% have diarrhea or GI symptoms. The labs, many of them have low white cell count. Many of them have BUN and creatinine going up, which is your kidney function. Liver function test can go up as well. And then when you get a chest x-ray, you see pneumonia bilaterally, and what we call ground glass opacities can occur. And of course, the standard care is to get them treated with supportive, isolate them in ICU-like setting. And of course, if need, fluids are given, ventilation is done, et cetera, et cetera. There is some interest in experimental medicines, and you probably heard in the news today, in the news conference, the president brought this up. There is some work going on studying some of the experimental medicines that was used for treating HIV, which is AIDS, those medicines. And also there's one particular antiviral drug that's ritonavir. Ritonavir is used for treating the H1N1 flu. And of course, the anti-malarial drug chloroquine is also being tried. Prognosis, again, we already talked about it, but it's worth talking about again. The best prognosis is for younger people, and the higher the age, the higher the mortality risk, at least based on the Chinese experience. So this is a snapshot view of what's going on with the COVID virus. I will stop sharing this as well. And then again, open up for questions regarding anything that I talked about, medication, visits, telemedicine, how you need to stock up on your medicine or anything of that sort. Any questions that you all have, this would be a good time to ask, and I'm happy to take on your questions.
Hi, Dr. Sub. Could you put that paper up from Seattle one more time?
Sure, sure.
Thanks.
Yes, it's there.
Got it. Thank you.
Yeah, and you can download this if you search under a Seattle intensivist one-pager on COVID-19. If you type that up, you should be getting it. Yeah.
Okay, perfect. Thank you.
Sure. Other questions? Samyu, do you want to? You have heard some questions before, so do you want to repeat some of those questions that Others have asked that they may have.
Hi everyone. I think you covered most of the questions that people have been asking, which is how does this affect those who have Parkinson's disease? And one of the big questions was in terms of medications, what they can and cannot take. And like Dr. Sub said, just make sure you just keep a good flow of communication with your physician and your neurologist throughout this time. And phone lines are okay, and you can call them, you can text your physicians, do whatever you need to get information, but try not to clog up the actual hospital spaces, both for your own protection as well as for like the resources available for people who need it right now during this time. Stay active, that's very important. Do some home exercises and take a walk outside. Just make sure you stay at least 6 feet away from others, and keep washing your hands, and don't forget to do that, and keep disinfecting all the surfaces in your house that you use frequently. But just mainly just take care of yourself, and also make sure you take care of your own mental health, because right now is a big stressor on, especially with the isolating nature of the situation right now. We're all home alone. We don't get that people time that we usually thrive off of. So call up friends, talk to friends, FaceTime with people. You just can't be in close actual proximity, but go out, take a breath of fresh air out in nature, watch TV, do things like that. But stay in touch with people, but don't isolate yourself like that. But physically stay away from people, just so that we don't spread the disease. But make sure you keep a check on your mental health, and make sure if you see anything, or if you see like you feel like you're having any difficulty with that, again, reach out to family, friends, reach out to your physician, and talk about things that you're feeling if you feel any sort of stress on your overall mental health.
Some of you also want to give the APDA number in case people want to call
Yes.
and talk. Yeah, if you want to use that number.
Yes, definitely. So our number is 717-531-0003, and the extension is 283767. I'll include this in the email that I kind of follow up with this, along hopefully with the recording of this session. But just feel free to call us with any questions you have, and we will try to get back to you as soon as we can with anything.
I also want to encourage people to go to the APDA website. Dr. Gilbert, who is a full-time MD, PhD working for APDA, has a very nice APDA website to deal with the COVID. Tim, can you mute your phone or your? We can hear you pouring water. So anyway, APDA, Dr. Gilbert has a very nice website where she discusses a number of these things in more detail. She also has a Q&A that you can access. Very nicely done. And again, I'm going to let Samyukta put that in your emails to all of you, where you can go in, and it's updated almost on a daily basis. She's updating with new information, medications, treatments, all those things are being updated as things go along, because this is a moving field and this is keeping on happening. So we like you to be updated as much as you can about this. Personally, I am available. I'm going to do this another time next week. We'll pick a day at a different time, maybe in the morning, so that people who couldn't listen now in the afternoon can listen in the morning. We'll also try to do one on the weekend, just in case people who are still working couldn't listen to it. We'll try to do that as well. Samyukta will record, she's recording this session, and we will put the recording in our APDA website. And we'll let you know where it is, so that people who couldn't listen today can go back and listen to it again. As always, we are available, both me and Samyu are available to be there for you and give you the support that you need. So feel free to use this as much as you like, and we'll get through this, okay? Again, thank you. If you don't have any questions, we'll wind up here. If you have
I have a
questions,
question.
okay, sure.
This is Tom.
Yes, hey, Tom.
Could Sam, you please put the Penn State app site in the email?
Yes.
Yes.
Yes,
I'll-
we'll make
I'll
sure.
put that up too.
We'll put that app in the for you. Yes, no problem.
Thank
And
you.
we'll put it in the email as well.
Of course.
Other questions? Anything else? So,
Dr.
yes,
Sue,
yes, yes,
I just have one question. What about like my father who has Lewy body dementia?
yes,
The same type of risk for him as Parkinson's does?
yes. Parkinson's, as we already discussed, doesn't give you any special vulnerability. It's the age-related vulnerability that is. So yes, and because I know how old you are, your dad is way over that age limit. So yes, he would have the same risks because of his age. And of course, if he has other health conditions in addition to Lewy body, that will also put him at risk because of just having those. But age is the big thing. Age is a big risk factor. Yes.
Okay.
Yeah. And I think all the rules that we just said about social isolation, physical distancing, good hydration, exercising at home, flattening that curve, limiting interactions from outside people, etc. All those rules are absolutely applicable, and yes, and it should be enforced on everybody over that age, over the age of 60. We should try to do that. Yeah.
Okay. Thank you.
Thanks. Other questions, other things that come up since we've been talking? Well, it's a pleasure talking to you all. And again, I'll come back and do this. If people missed it and you heard about it, we'll do it again. Bye. See you guys. Bye.